Alright everyone, well welcome to another episode of PharmD&Me. Today we're going to be discussing tobacco cessation, which is really a topic that's important for pharmacists to have a good grasp on, since many patients will come to us when they need to try or want to try over-the-counter remedies to resolve their addiction. The guidelines for tobacco cessation primarily come from the Agency for Healthcare Research and Quality, also known as AHRQ, so if you'd like more information, you can look there. There are many first-line medications for tobacco cessation. There's actually 7. 5 being nicotine replacement therapy, and the other 2 being Proprion SR, and then varenicline or Chantix. Many of these medications are used in combination with each other. For instance, there's both short-acting and long-acting nicotine replacement therapy, and they work by essentially helping to eliminate withdrawal symptoms. Now, when we think of withdrawal symptoms, we typically think of, an urge to smoke, but there's many other symptoms that can manifest. So patients may describe having a depressed mood. They may be having difficulty sleeping. They can have irritability. They can also feel anxious. They may have difficulty concentrating. And they can even have bradycardia. And then the dreaded one, which is increased appetite and weight gain. So as you can see here, there's a plethora of ways that this withdrawal symptoms can manifest, and the medications can help to alleviate some of that. I'd like to also take a moment to discuss drug interactions. So when patients are smokers, the tobacco and the cigarette induces the enzyme cytochrome P450-1A2. So that essentially means any drug metabolized via this route is going to be rapidly eliminated in the body. So when all of a sudden they stop smoking and they're not inducing that CYP1A2, they can get super therapeutic drug levels of things like caffeine, theophylline, fluvoxamine, olanzapine, and clozapine, which that can even result in agranulocytosis. So it's definitely something you want to be aware of. Additionally, there's some interactions that can occur just for patients smoking in general that are good to be aware of. So if you smoke and you also are on Plavix, this can result in an increased risk of bleeds. Or if you smoke and you're on estrogen therapy, this can lead to increased cardiovascular adverse events. So you definitely want to be aware of these things. And also, remember, patients that are on warfarin, they too might have an increased bleeding risk when they stop smoking. Now, after talking about the drug interactions, let's talk a little bit about vaccinations. So the guidelines recommend that patients that are 19 to 64 years of age that are smokers should receive Pneumovax or PPSV23. Alright, so now let's move on to some of our medications. First, we're going to talk about nicotine replacement therapy. And before I really get into the medicines themselves, I'd like to first go over the contraindications. So they're mainly cardiovascular in nature. Patients that have had a recent MI within the past 2 weeks should not be using these medications. Additionally, if they have any life-threatening arrhythmias or severe or worsening angina. And lastly, pregnancy. Side effects to be aware of. There's different ones for different agents, which we'll go over, but just in general, you can have headache, dizziness, nervousness, insomnia, and dyspepsia. And then something to note, they need to show an ID, of course, when they get these medications, because just like cigarettes, you need to be at least 18 years of age to purchase. So now let's talk a little bit about the individual agents. So the most common one is the nicotine patch, and this is dosed based on the amount of cigarettes they're taking per day. So if they're using more than 10 cigarettes per day, they're going to want to start out right away with the highest dose, that 21 milligram patch for 6 weeks. They're going to then taper down to 14 milligrams for 2 weeks, and then 7 milligrams for 2 weeks. If they're taking less than or equal to 10 cigarettes per day, they're going to, instead of starting at the 21 milligrams, they're going to start at only 14 milligrams, and they're going to do that for 6 weeks. 6 weeks. And then the 7 milligram for 2 weeks. So, the way that they're going to administer this patch is upon waking. They're going to place the patch between the neck and waist, so somewhere on the upper body. Now, a common side effect with this is sleep disturbance. If they experience any sleep disturbance, you can recommend that they remove the patch prior to bedtime. Another adverse effect can be a skin reaction. And if this occurs, you really want to make sure that they're rotating the patch application sites. And if it really gets intolerable, they can use hydrocortisone cream 1% or a triamcinolone cream as well. The next medication we're going to talk about is the gum, the Nicorette. So this is based upon how soon after waking up they need a cigarette. So if it's more than 30 minutes, they're going to use the 2 milligram gum. If they need a cigarette less than or equal to 30 minutes upon waking, they're going to use a 4 milligram gum. And they're going to taper this similar to the patch. So, on weeks 1 to 6, they're going to use this gum every 1 to 2 hours. It's imperative that the patient understands this. Many patients think that's too frequent. They don't take it that frequently, and they suffer withdrawal symptoms. Weeks 7 to 9, every 2 to 4 hours, and then weeks 10 through 12, every 4 to 8 hours. They can have a max of 24 pieces per day and use it up to 12 weeks. Additionally, it's important that the patient understands how to administer this. Many patients just chew it like a regular piece of gum, but that's not how you're supposed to take it. You're supposed to chew it until you get a peppery taste. And then park the gum between cheek and gum. And this will really allow for maximal absorption and the greatest benefit for the patient. Again, a lot of patients underdose, so make sure that first 6 weeks they truly are taking it every 1 to 2 hours. Alright, so now we're going to move on to the lozenge. Lozenge is dosed in the same as gum, so based upon how often or how soon upon waking they need this first cigarette. They can have a max of 20 lozenges per day, and they really need to be taking at least 9 lozenges per day for the first 6 weeks. As far as admin instructions go, allow to dissolve in mouth. Do not chew or swallow, or you won't be getting the benefit. Again, make sure they're using it every 1 to 2 hours the first 6 weeks to avoid the withdrawal symptoms. And something interesting to note is that Both of the gum and the lozenge are sugar-free, so safe for your diabetic patients. Now let's move on to the nicotine inhaler. The nicotine inhaler and the nasal spray are both RX, whereas these were all over the counter. So for the inhaler, the patient typically is prescribed 6 to 16 cartridges daily. And the prescriber also gets the patient up to a maintenance dose, and then they keep them on the maintenance dose for 3 months. Then they're going to taper them over another 3 months for a max of 6 months. So this is going to be used in a similar method to using just a cigarette. You're going to want to frequently and continuously puff it for 20 minutes. Additionally, you want to let the patient know that they need to clean the mouthpiece regularly, and they can do that with soap and water. You'll also want to let them know that keeping it anywhere where it's less than 40 degrees Fahrenheit can significantly impair the delivery of nicotine. So I recommend keeping it in their pocket where it can stay warm. And once a cartridge is opened, it's only good for 1 day. And then for the gum, the lozenge, and the inhaler, so all 3 of these, do not eat or drink 15 minutes prior or while using, or the absorption will be impaired. Alright, so then the nasal spray. The first thing to note with this is that 1 dose equals 2 sprays. So you're going to give a spray in each nostril every time you give a dose. You want to give 1 to 2 doses per hour, and then increase as needed for symptom relief. Max you want to give is 5 doses per hour. You can use this for 3 to 6 months. And the major complaint with this one in particular is nasal irritation. About 80% of patients will actually experience this. And what you want to tell your patients is to keep their head tilted slightly forward or level. Do not tilt the head back. That will really help to prevent the irritation if they don't tip it back. And then something unique about this one is wait 5 minutes to drive or operate machinery, as it may cause tearing and sneezing. So those are all our nicotine replacement therapies. Now that we've discussed that, we're going to go on to our 2 prescriptions outside of our inhaler and nasal spray, of course, but the 2 tablet prescriptions, which are the Proprion, sustained release, and the varenicline. So the Proprion, also known as Zyban, works by blocking the reuptake. So we got our nervous cell, or synapse here. It's going to block the reuptake of either norepinephrine and or dopamine. When this occurs, you're going to have reduced cravings and reduced withdrawal symptoms. Alright, so you're going to dose this one by initiating 1 week prior to quit date. That's the same for both of them. And you're going to give 150 milligrams every morning for 3 days. And then you're going to give 150 milligrams twice a day. Now, some patients experience a lot of insomnia with this medication, so it is permissible to take the second dose as soon as 8 hours after taking the first dose if the insomnia is bothersome. You may take it for up to 6 months, but if no significant progress by week 7, typically recommend discontinuing it. And something unique with this is you don't actually have to taper when you discontinue. Alright, so some side effects to be aware of with this one are the dry mouth and trouble sleeping, which, as I mentioned, they can take that second dose within 8 hours of the first one. It does have a boxed warning, and that is for serious neuropsychiatric events, including suicidal thinking and behavior. Risk of is definitely increased in your younger population, your young adults, but regardless of age, you do want to counsel your patient on this risk. Contraindications are typically are mostly neurological in origin, so any type of seizure disorders, history of an eating disorder, any abrupt discontinuation of your anti-epileptic drugs, your alcohol, benzodiazepines, barbiturates, and then you don't want to use it within 14 days of an MAOI. Or any other form of Proprion. Alright, so then moving on to Chantix. This is a partial nicotinic receptor agonist. So it's going to bind where it was binding when you were smoking. And this leads to competitive inhibition of nicotine binding. And this receptor stimulation helps mediate nicotine withdrawal. So similar to the bupropion, you want to initiate it within 1 week prior to quit date. And then on days 1 to 3, you're going to start it out at 0.5 milligrams daily. You're going to titrate up to twice a day on days 4 through 7. And then day 8, which is also your quit date, and beyond, you're going to take 1 milligram twice a day. Notably, this requires renal dosing. So if the creatinine clearance is less than 30 mils per minute, only 0.5 milligrams daily. You're going to use this for 12 weeks. And if needed, you can continue another 12 weeks if needed for successful smoking cessation. Again, no need to taper. Common side effects seen with this one is nausea, seen in about 30%. It is dose dependent, so we recommend either decreasing the dose if you have to, but first thing I would try is to take it with food, so always take after eating and take it with a full glass of water. It can also cause insomnia, abnormal and vivid dreams. Black box warning is the same as the Proprion, the neuropsychiatric events, including suicidal thinking and behavior. Be sure to stop it if you notice any of that. And then some warnings to be aware of for this one are seizure risk, increased effects of alcohol, and it may cause SJS. Alright, so one last thing I want to add is that while medications do help with smoking cessation, another huge component is counseling. And studies have shown that counseling with medication is more effective than either alone. So it's important that we provide practical counseling to our patients, such as problem-solving skills. So most patients typically have cravings that last for about 20 minutes. So getting them to come up with ideas for what can I do to get through those 20 minutes to push through. Instead of eating or smoking, can I do a hobby? Do you like gardening or something of that sort? As well as social support. And another great resource to remind our patients of is the hotline for National Tobacco Quit Line, which is 1-800-QUIT-NOW. Alright, so that covers smoking cessation. Thank you for watching.